I'm Dr. Brett Smith, and I'd like to spend a few minutes talking about VO2 and what VO2 is and some of the benefits of understanding our VO2. So really the idea behind a VO2 is, what is that? That may not be a familiar term for a lot of people, so I just wanted to define that. A VO2 max is really our body's ability to use oxygen as a fuel source. It might seem kind of obvious that we all use oxygen too, but it's at a much higher level. VO2 is a pretty good indicator in the literature actually of not only our functional status as we age between 40s and 50s and 60s and such, and also the longevity of our lives too. I'll post some articles here that ton of reference VO2 max as a good predictor of longevity, but it really is our body's ability to use oxygen and other avenues as a fuel source at a very high and intense level. It's not something you would want to test all the time because it doesn't change every 2 to 4 weeks, for example. It takes months to change typically, but everybody has a VO2 max. And really, the question is, what is a good VO2 max? And I'll post some of the charts as well too, but a VO2 max is really going to be defined by standards in the general population too. So that would be dependent not only on age, but also by gender as well. And there are some charts in the literature that help define individuals that are in the 95th percentile, 75th, 50th, 25th, etc. By those standards too, and we can help measure those to figure out where people are at. Unfortunately, we should expect to lose about 10% of our VO2 about every decade too. So if we say maybe around age 30, we start losing that VO2 max at about 1% per year. By the time that we're 60, we've lost about 30% of that energy utilization reserve. Now, that's not true in everybody technically, because there are those individuals that actually train from a cardiorespiratory fitness standard at a very high level, and they actually do significantly improve the VO2 max, so their rate of decline is much slower than the general population that is not training VO2 max. And really, VO2 max is partly genetic, so you're going to see some portion of that be genetic, but VO2 max is very trainable as far as we know. And those changes are mostly seen from cardiac structural changes, so there are some indications, as we age that our heart rate goes down. So we typically lose the ability to beat faster as we age. So there are lots of formulas out there too, but we can also improve the cardiac structure we have and improve the stroke volume. So we pump a higher percentage of blood with every pump that we have. And there are some other accessory changes that are made with increased capillary development and better oxygen utilization and many other avenues as well too. And really there's a couple ways to test VO2 max. I know a lot of the smartwatches, they have the ability to predict VO2 max according to it. There is some literature around that to suggest that maybe they are relatively accurate. I don't personally believe they're that accurate too. I mean, I have a VO2 max estimator on my smartwatch too, and when I tested my VO2, it was actually probably about 50% different compared to the standard of care, which is actually gas exchange. There is a number of machines that are available across the country that test VO2 max, which can be done on a bicycle or a treadmill technically. We use a cycle currently at Tennessee Direct, and that VO2 max through the gas exchange is actually the gold standard for testing too. So if anybody was interested in a VO2 max, I would typically recommend that you use the gold standard testing rather than an estimator too, because the estimator is not a really good indicator of what your VO2 max is and how to track that over time. So here at Tennessee Direct, we do have that ability to test your VO2 max, and not only to test it, but also to program the ability to help you improve VO2 max over time, depending on what your schedule is and what your interests and your goals are, of course. They'll be personalized to you as an individual. And really the measurement is also in milliliters per kilogram per minute. And so we're measuring how many milliliters of oxygen we can use per kilogram of body weight per minute that we are active or we're on the cycle or the treadmill. And it's really important to know that number too, because even small changes can actually make a huge difference in our lives and our health. There's some data that I'll cite as well too that shows that even a 1 milliliter per kilogram per minute difference can actually lead to like a 9% reduction in overall mortality. And that's pretty phenomenal that a 1 milliliter difference can actually reduce our chance of early mortality by almost 10%. You could certainly see a 1 milliliter difference, in a matter of weeks, 4 to 6 weeks in a lot of individuals with the right training as well. So as we see 2, 3, 4 milliliters per kg difference too, we start seeing substantial drops in mortality with incremental movement early on in a lot of people too. The absolute number matters too. Obviously, if you're starting from a very high level, 80, 90th percentile as well, it's a little harder to move that needle, but those changes are super important to maintain longevity in the general population. But obviously, the lower your VO2 is, the faster it's going to move up, of course, with the right level of training. And interestingly enough, it's actually possible to have a lower biological age than a chronological age. And what I mean by that is that if somebody's 50, for example, they may have the VO2 of a 30-year-old, which improves the way they operate biologically on the inside, which makes them biologically younger, technically. So even though they may be 20 years older, their body perceives that they have the fitness and the health span of a 30-year-old too in a lot of ways. So VO2 is an accurate tool not only for assessment, but also to improve the biological clock that we have as well long term. And really, when you look at the literature, is cardiorespiratory fitness, which can be a double-edged sword for a lot of people too. It really allows us to live longer. It allows us to live longer and better. And it really is something that can be moved quite well in a lot of people too. And people gain cardio fitness in fairly short periods of time, weeks to months, that people can improve. Becoming an elite athlete is not in the cards for most of us, and that's not what we're going for. We're going for a higher quality of life and a longer life many times. But generally, cardiorespiratory and a good VO2 actually allows us to have a good basis for longevity. So I'm going to post some articles here in the video, and I would encourage anybody that's interested, ask questions, send us an email. But we do our VO2 all the time at the office too. I probably do mine about every 3 months at this point. I would encourage you, if you're interested, ask questions, post comments, book a VO2 with us too, and let's see if we can get you started and see if we can get you on the track to longevity and health span. And I appreciate you watching.